Condition specific versus multifunctional. Where is the supplement market heading next? This juxtaposition in product development approaches has been on my mind for quite a while. There are just so many considerations at play here coming from both the brand level and supply side of the supplement industry, but also how it all interacts with consumer behavior. So, what's the future of product development within the supplement industry heading towards? Condition specific or multifunctional formulation approaches. To help this content have a strong foundation, I should probably start by explaining how I define these two different product formulation approaches. When you hear someone mentioning the term condition specific in or around the supplement industry, they are talking about targeting health conditions. There are dozens of health conditions that supplements might provide prevention benefits for, such as brain health, healthy aging, beauty from within, heart health, diabetes, menopause, and weight management, just to name a few. Naturally, that would mean that multifunctional products mash up two or more of those condition specific intents that are usually complementary or have adjacency in the consumer's mind. You could at times hear industry jargon like name a condition specific plus. So, gut health plus or immune health plus, you get the point. Definition wise, fairly easy to understand. But what I'm much more interested in is the motivations between the various stakeholders in this situation. So, suppliers, brands, and consumers. From a supply side perspective, it's important to recognize that condition specific doesn't necessarily mean ingredient specific. Certain ingredients could have tremendous potential to support multiple health conditions. So, why do ingredient suppliers focus on bringing condition specific innovations to market? It's coming from a demand signal that starts way down at the consumer level. Moreover, suppliers frequently hear from brands that they are developing condition specific products and are looking for specific ingredients with focused benefits. The condition specific B2B marketing approach has become a commonly used method to differentiate products as it's easy to do, can be very efficient, provides focus, and is easy to replicate if a supplier has multiple trademarked ingredients. On the flip side, while condition specific concepts do help suppliers with what I mentioned and gives formulators maybe a better understanding of how an ingredient can be used, anchoring bias could sabotage the ingredient's expansion into one with multifunctional benefits. But far and away, when we talk about condition specific versus multifunctional, it's more of a question of interactions between supplement brands and consumers. Condition specific is not a new approach in the supplement industry, as you can find references to this trend from 2 or more decades ago. It has gotten more prominent in the last few years, though, because of the overwhelming product proliferation within the supplement industry. Since consumers are easily confused by the array of options available to them, condition specific products can help these overwhelmed consumers feel empowered and enable them to take charge of their lives in a way that is convenient and understandable. That seems obvious enough, but let's go a few layers deep on this debate. For one, I mentioned convenience above, and that word can be defined in a variety of different ways. Yes, saving time by making the discovery process of beneficial supplements quicker is convenient, but so is the ability to consume less supplements daily in the form of multifunctional products, right? We would be ignorant if we didn't believe a subset of consumers appreciate convenient, multifunctional products that can meet several wellness goals. But there's also some other kind of attributes at play in this condition specific versus multifunctional debate. Think about one of maybe the most important purchase criteria, price. Now, this isn't universally true, but the more health conditions a supplement is targeting, a decision usually needs to be made by that entrepreneur. One, the product is dosed efficaciously and is crazy expensive, or two, the product is underdosed to meet an acceptable consumer price point. Again, this isn't always really a black and white situation. I can think of really many things that can poke holes in my statement, but generalizing this all, When consumers seek the best of the best supplement that's also priced acceptably and targeting a health condition, it would come in the form of a condition specific solution. Moreover, that consumer behavior transitions into the desire for personalization. Again, a consumer might find a multifunctional product that's dosed appropriately at the right price and targeting the exact health conditions they desire. But when we're talking about a make to stock product, meeting all those combinations consistently is really unrealistic. Either something will be underformulated, overpriced, over engineered, targeting undesirable health conditions, or the opposite of all that. The multifunctional approach creates a situation where personalization overall goes way down. Another important purchase criteria when talking about ingestible CPG with delivery systems that have a flavor element, like powders or beverages or gummies or foods, is the fact that blending way too many ingredients could present some challenges when we're talking about taste or also stability or solubility. Taste is king, so just because you have a multifunctional product that's dosed efficaciously and the price might be right to the consumer, if it tastes like shit, you will rarely be successful in today's supplement industry. Similarly, the more ingredients you include, the availability of using non flavored delivery systems like capsules, tablets, or pills go down because it would create another consumer behavior red flag of increasing the quantity too high. Finally, I want to talk about retail merchandising and commerce overall. When you create multifunctional products, it can cause some issues with legacy retail merchandising models. I always say products are built to fit with sales channels. Sales channels do not mold to products. So if you have a nutri-cosmetic product that is also focusing on weight management, where does that retail partner merchandise you at inside of their physical stores? I admit this is really less worrisome for a lot of the supplement category because most large retailers have a dedicated healthy living catch-all type section right now, but it shouldn't diminish that concern altogether. With e-commerce and Amazon specifically, there's another natural consumer behavior to be conscious of when thinking about this condition specific versus multifunctional decision. This was among a collection of insights captured during a recent conversation I had with Richard Wang, the CEO of the ingredient company NuLiv Science at the SupplySide West trade show. I guess one of the themes of the show, and I've talked to a lot of people already, and know we're still kind of getting going here, is that there's the multifunctional approach to product development or condition specific. From your perspective, where do you think the market's going?
If you look at Amazon data, right, very few people are looking for multi stuff. They're looking for my joints hurt, so I want something I can focus on, or I have inflammation, buying specifically curcumin. Yeah. So I think your general audience is getting smarter, so it's more condition specific. But in our space, brands are using an easier entryway to maybe hook more of that audience.
Yeah, I think you brought up a good point around Amazon and that the way that a consumer looks for products on Amazon is very much intent driven. Hey, what's a joint supplement? What is that actual thing that I'm looking for? They know they have a problem or at least something they're trying to optimize, and they're going, okay, I want a non-branded search term based around what that problem is. They're not looking at branded search where it's all about, and I'm not going to name any names, but just those are less prevalent or from a volume standpoint or quantity standpoint than the non-branded searches. They're just looking at is it sleep supplement, whatever, because they're thinking, oh, there's supplement for sleep quality or whatever. And I think that plays into what you're talking about with condition specific. I think is where really the market goes and where the consumer matures to, because eventually they want to have I want to say the best of the best of each specific product. And I know you guys have a ton of ingredients that are condition specific, and you have a lot of partners that are looking at you guys from an innovation partner. How do you think about innovation? How do you think about making sure you give your partners what they need to ultimately be able to position themselves in those niches?
I would say half that conversation is driven by brands, right? Which ultimately are partners, I guess. It's a nice way to phrase it. Thank you. it's what they're looking for. We just have the data, right? And it's our job to tell the story of the data. But it's really up to each brand that want how to position and market themselves, right? As far as innovation is, in my opinion, slow, and it should be. Like, you can't come out with something every quarter, every year, right? Our IP timeline is 5+ years. Like, we have patented ingredients we're sitting on for 10 years. We're still building out the data set. We're still building out the inconsistencies, for example, in the organoleptics. Like, okay, why is the color changing periodically, right? Yeah, understandable, harvest, blah, blah, different harvest time, but like, so it takes a lot of time for us to come out with something innovative. It's really cool seeing what the industry provides. I was having a professor, right? We just funded a study at a California university. Okay. He's been in the industry 20 years. More, actually, a little bit more. He's like, I've seen everything come and go, man. GNC tests their stuff at me. Other companies come here and test. Sometimes the data is okay. Sometimes the data is irrelevant. 5 years later, some other company will come to me with the same thing. I'm like, I've already done this. The industry keeps forgetting they want something new and innovative. But so he said to me, he truly hasn't seen anything super innovative in a long, long time.
It's a good point you bring up, because I think I always mention this, like, life is about remixes. Like, we're always taking from the past, and we maybe are dialing in a little bit here and there to kind of change it up. But really, everything has probably happened before in some sense or another.
Yeah.
But what I loved what you said about like how innovation, sometimes takes 10 years or something. Like, the conviction level on the supply side that you need to have, like, you're not talking about working in and out with like fads. You're talking about, we're going to make a hardline approach to a specific trend that we think is going to be the next 30, 40, 50 years. And I think one of the ones that I know I've been like barking about for a long time, and you guys do a lot of work about, is sleep.
Right.
Like, we are over caffeinated, we are over stimulated,
adrenal fatigue.
Oh my god! And it's like all of a sudden people are starting to think about sleep differently, which I know you guys have gotten like a ton of momentum with one of your ingredients, right?
We have a sleep compound. We all take it. The cool thing about sleep is, look, there are proven pharmaceuticals for sleep, right? So everything has their place, but like, is there something a little bit less habit forming that might have more of an origin from the ground up, like a plant, or in our case, a fungi? So that's kind of our goal. It's really cool watching it, because this is not new. What we have is it's existed in the Chinese literature for hundreds, if not 1,000 years, right? But just no one's ever taken it and translated it, right? Like, okay, come up with an actual like materials and methods and everything. Come up with a data analysis. Like, it's always been like, okay, just take this, you feel great. Drink this tea tincture. And it's been kind of like that anecdotal storytelling over the years. But like, no, let's validate this, at least at the most earliest stage biologic, right? So that's the cool thing. It has its place. I think 70 million people, 60, 70 million people have some kind of way to track their sleep now. So if you could do that, you can see, oh shit, I can see my sleep getting better. Whether it's through just yoga, meditation, or like through hopefully it's something a little bit more holistic and natural, or pharmaceutical. I think that's kind of where the market's trending.
So I just want to end on some quick final thoughts. We know that ingredient advances are enabling formulators to create products that can address a broader cluster of health concerns. At the same time, supplement brands are finding opportunities in smarter, more targeted products that appeal to specific subsets of consumers. Is there a central best approach to attack the supplement market? No, but if I was looking to start a supplement brand today, I would be more inclined to build condition-specific solutions that are a mile deep and an inch wide while using a diversity of formats. While there's no hacking your way to success in today's ultra-competitive supplement industry, I believe that approach gives you at least a marginal advantage. I hope you enjoyed this YouTube video. If you did, consider hitting the like button to support me. Also, help me get to my short-term goal of 2,000 subscribers by hitting that subscribe button. I'd love to see you join me on this journey, but we need to fix the fact that slightly less than 80% of you that are watching this YouTube video right now are not subscribed to my channel, and that makes me extremely sad. But I do want to thank you for tuning in, and I'll see you on the next one.